So who is not a candidate for hair transplant surgery? Now, this can vary from doctor to doctor. For example, some surgeons may argue patients with diabetes are not candidates for treatment. However, some surgeons may disagree and say if the patient has a well-controlled HbA1c for the last couple of months, then why not? But you must consider things like autoimmune conditions such as alopecia areata. Patients who have dermatitis and other skin problems can also affect the surgery. Another thing to consider who is not a person for treatment is patients who have unrealistic expectation. This is something that a patient needs to discuss with their surgeon about what is achievable. Things also to consider for surgeons and for patients also is about timing and what can be done in terms of the growth, how quickly they want the results. Again, this all falls down in the same category about expectation. So it's also important to understand who is a candidate and who is not. There's a lot of information out there, but just make sure you discuss with your surgeon.